Good afternoon, everyone. Welcome to Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer, help the caregivers and patient to access the right treatment on right time. As you all aware that in our last two sessions, we have learned many things, how to approaching awareness of head and neck cancer, as that April month was dedicated to head and neck cancer awareness month. Today, in the continuation to that session, let's understand about the nutrition in head and neck cancer from our esteemed expert, Dr. Krishnamani, who is associated with who is a medical oncologist with more than 10 years of experience, and Dr. Krishnamani is associated with American Oncology of Institute in Hyderabad. So let's extend a warm welcome to Dr. Krishnamani. Good afternoon, doctor.
Good afternoon. Hello. As always, welcome everyone to Cancer Reach, which is an initiative to spread awareness about cancer. Today, as you said, we will talk about nutrition in head and neck cancer because it's a thing which concerns patients the most. From a medical perspective, I don't think it is given that much of importance, or even from a patient perspective, because see, when somebody is diagnosed with cancer, the first thing he or she wants is, what is my stage? Are you going to do surgery or chemo or radiation? Or what are the side effects, vomiting, etc. But the nutrition part, the unnecessary parts come to the mind, like, can I eat non-veg, or can I eat sugar, these kind of things. And the value part of nutrition, like how well you should be fed, what are the types of nutrition, which are the cancers in which nutrition has the maximum impact, what happens if you are not adequately nourished, or if you become cachexic or malnourished. These things are not part of regular conversations. And more importantly, especially in head and neck cancer, the patient should have an idea from day one itself. The reason being, see, it's a disease which starts in this area. It's the head and neck, or the oral cavity area, or the throat area. This is an area which interferes with swallowing, which interferes with speech, which interferes with saliva production, and where there's a difficulty in eating. So, and with the treatment also, there are going to be side effects. Side effects in the form of dry mouth, in the form of nausea, in the form of vomiting. All this is also going to impair your ability to have good food. Once you don't have good food, it will have an impact on your health. And once your health is not good, your treatment will have an adverse impact, or the side effects will be more.
Okay.
So this is a cycle. So every head and neck cancer patient must understand that nutrition is actually the central part of his treatment. His feeding, his general health, his body weight, his muscle mass, his or her muscle mass, they shouldn't lose weight. These are all the key factors in that patient's journey towards, one, taking treatment, two, completing the planned treatment on the planned time. Planned treatment may be 6 chemos. It should be done in 6 weeks. If you do it over 4 months, there is no point. So that is why nutrition is extremely important for them to understand that will only take them forward. And how their nutrition is going to be maintained is something they should understand, and they should have a discussion with their caregiver.
Very true, doctor. Nowadays, actually, rightly said, when they hear cancer, they will just think that what cancer, how many treatments, what will happen, but they never think about what should be taken, how to get. I guess the nutrition also plays a role for a better and early treatment, at least to a support for the treatment.
True.
Nobody
True.
take cares of it. So, doctor, moving ahead with this, does this head and neck cancer, as you were saying, do really impact any nutrition?
Correct. So the common example I usually tell patients is to keep it very, very simple. Imagine you have a cancer on your thumb. Will it
Mm,
affect your nutrition? No. You're going to eat well. You're going to eat well. You're going to eat whatever you want. Your mouth doesn't have any dryness. You have no difficulty swallowing, no saliva production problem. You don't have any mouth ulcers. Either you're going to operate this or give some medication, whatever. The whole problem is this head and neck cancer comes in this area where dentition, tongue, the mouth, salivation, swallowing is the key.
Yes.
So food intake is a process in which you put food into the mouth, You have to chew, mix it with saliva, okay, and then swallow it. And then after that, it obviously gets digested and absorbed. So this is the primary process. So a cancer here, or an ulcer here, or dryness of the mouth, or no saliva or minimal saliva production impairs that process.
Very true, sir.
So that's the issue. And the problem is not only the cancer. You imagine you give radiation to somebody, they will develop dryness in the mouth.
Mm.
Or you give chemotherapy, it causes mucositis. Mucositis means the mucosa, the inner part of the oral cavity, that gets damaged. So anything they take, they have a jittery sensation, a spicy sensation. They can't take spice, forget it, even a normal thing. Sometimes even water is difficult. So your disease will cause this problem. Your treatments will cause this problem. After surgery, they remove a part of the tumor, they put a flap. It becomes the tooth are removed. So they are put on a Riles tube, a tube through the nose because they cannot take. And as we discussed, many of these patients take tobacco. So when they
Mm.
take oral tobacco, chewable tobacco, the mouth opening is not there. We
Yes.
discussed last time. That's called
Yes.
trismus. So the mouth
Christmas.
is only this much. It's like this. So you can't even sometimes put a finger in the mouth, one finger. Now,
Mm.
if I open my mouth, you can put an entire hand into somebody's mouth.
Yes.
Imagine
Very true.
if you can't even put a finger, that means the mouth opening is so restricted. That person survives literally on liquids through sipping through a straw. So what liquid will give you the calorie like a dal rice with one sabji or three chapatis or some curd rice? No, it cannot compensate. So
Yes.
your habit leading to trismus, your tobacco chewing, your cancer being in the oral cavity, your treatment leading to dryness and mucositis,
Mm.
and feeling of pukiness, nausea, vomiting because of your treatment, all this impacts your ability to eat, which
Yes.
your nutrition goes down because of that, because of which you lose muscle mass, body mass.
Mhm.
Okay, you become skin and bone. And on that, you are taking cancer treatment for which you need real good energy. So your body is on a negative side, on energy wise, not on positive side. That we call it anabolism, not yeah, catabolism. Catabolism is breakdown of energy. So you're on a negative energy spree.
Mm.
So your body is not able to, you're not eating also at the same time. Treatment is also pulling you down. So that is not going to help.
So it is like all the pressure coming to a patient. So there is no opportunity, good opportunity to gain nutrition properly.
So we know now these are the reasons for the head and neck cancer patient. So this person should be aware. Okay, this is what is going to happen to me because of all these reasons. Now, how am I going to cope up with my treatment and maintain adequate nutrition level or more than adequate nutrition level
Hmm.
so that I come here, I don't go down,
At least to maintain or to
maintain.
take care like with the therapy. Doctor, like you were saying that in head and neck cancer, the taking nutrition can impact. But how important is nutrition for that patient who is taking like head and getting the treatment of head and neck cancer?
So obviously, without nutrition, what's going to happen? Your quality of life will be poor.
Yes.
Your energy levels will be down. You will not be able to take treatment on time, because of which your survival is also diminished. You take cancer treatment on time only, you will do well. If you're
Yes.
unable to take treatment, whatever reason, I may be very physically good. I'm not coming for treatment properly. I'm non-compliant. So I'll do bad. You are very, very poorly nourished. You are unable to come for treatment. So you will also do poorly. So nutrition, that's why has a it's a directly proportional event. You're well nourished, you have good nutrition, eating good food, you will tolerate treatment well. And it has a positive outcome. Otherwise, it's on the downside.
So, doctor, like now you were saying that it is how important. Is there any like negative impact, or if the patient is not having any adequate nutrition, what can be the negative impact for that
It
patient?
impacts survival. Simple. It
Oh,
impacts survival, impacts your ability to take your treatment on time. It impacts your quality of life.
so it is like it is something like doctor, the patient is in such a tough road. The road is there, but the entire road is filled with needles.
Very
He
true.
cannot walk, but if he walks, it will be very painful kind of a thing. But he cannot avoid walking.
No, this is a very tough thing, and our patients have to be supported. They have to be motivated. They have to be encouraged. They have to be educated that, see, boss, this is the problem. You better face it right from the beginning itself, especially during radiation. It's a 6 weeks treatment.
Oh.
First 2 weeks are jolly, nothing will happen. Third,
Hmm.
fourth week, problems start. Okay, difficulty in swallowing, anything goes
Hmm.
in, you have a painful sensation, constant salivation. So tell them beforehand, gargle well 5 to 6 times a day with betadine or with salt water or with any kind of mouthwash. Take liquids adequately, hydrate your mouth, especially during summer months. Take semi-solid food, okay, like
Hmm.
dal rice, curd rice. Put it in a mixie like a porridge and have it. Take lots of juices, coconut water if you're not a diabetic. Okay,
Hmm.
take liquids, keep hydrating yourself, stay away from hot environment, especially now Hyderabad. 42 degrees is when we are talking to each other now.
Yes,
My
very
computer
hot.
is showing it's 42. So avoid hot climate. So these are all the things they have to take care. Hydrate yourself, take liquids, take a lot of semi-solid food, home food, no spice, no Swiggies, no Zomatos, no outside food, no chaat bandar, no masala, avoid chai, coffee, more of fruits, juices, which have that nourishing value, which have a lot of vitamins and minerals. Those things will take them to the third or fourth week. At that time, if the intake goes down also, this first 2 weeks will try to compensate for it.
Actually, sir, when you were saying about the chaat bandar, I was thinking that the tobacco eater can never eat pani puri because he cannot open his mouth.
Yeah. Unfortunate. The unfortunate part is, see, again, coming back to why we are doing all this is we just want our people to quit tobacco. There
Yes.
is nothing here. Whatever we talk, even now we're talking about nutrition.
Hmm.
It's very important for our patient because we see our patients going through that pain and suffering that they cannot eat. See, the joy lies in eating, right? See,
Yes.
everybody, all of us will say, anybody young or old, all of us enjoy. See, east, west, north, south, we all love eating, and the joy lies in eating. And if a person is unable to eat, and why are you going through this? If it is, I'm not saying all the head and neck cancers are due to tobacco, but you can avoid tobacco, right? And prevent getting this cancer, then you're doing yourself a great service. Yeah,
At least a basic cancer can be avoided with by
yeah,
quitting tobacco.
we should.
So, doctor, now like in this tough situation, what are the routes to provide feeding?
See, the oral route is the best route. God has given us this route of feeding, which is the best route. Then there
Yes.
is another route called enteral route, and then there is another route called parenteral route.
Hmm.
So if somebody is not able to take orally, the opening is very low. There's a lot of mucositis, a lot of ulcers, okay, fungal infections,
Hmm.
preventing them to swallow, especially head and neck cancer patients who are on radiation or post-surgery. What we do is we put a small tube through the nose into the tummy.
Okay.
It's a small procedure. You can do it in the office right now. You're going to just put some jelly, which is a lignocaine jelly, we say, that is an anesthetic. It will be a
Hmm.
jelly-like paste-like thing, so that when
Hmm.
the tube goes, they don't have any sensation. And it's a small tube. You put it through the nose. You ask them to swallow and
Hmm.
keep swallowing. And when they swallow, you keep pushing it down, and it goes down into the throat, into the stomach. We check
Okay.
it. It has one end. We check it once whether it is rightly in the stomach with a stethoscope. And if it is in position, you start the feeding. What is the
Oh,
advantage? Instead of eating like this and going into the stomach, this is going through the tube into the stomach.
okay.
So the bottom line is food is going into stomach for absorption.
Okay.
So you are not the natural way, but you are close to the natural way.
Very true.
Okay. The other route is, so this is called a Ryle's tube or a nasogastric tube. So the
Oh,
advantage is it's a simple procedure. It can be done in the office. It's relatively inexpensive, hardly 100 rupees or 50 rupees. Just put a Ryle's tube. Okay. Cost of the Ryle's tube, that's all. And you can feed, and it goes into the stomach.
hmm.
The disadvantages are, see, somebody can pull it off, or if
Yes.
it's not properly secured in the night or whatever, it can come out. You have the feeling that you have a tube like this. So cosmetic issue. When you're walking, people are looking, you have a tube out of the nose and all that. Okay. And that's the issue. Now, to avoid that, you can do something called a feeding gastrostomy. So you can do an endoscopy and put a tube into the stomach directly. So
Okay.
that is more private. That can be concealed under a shirt or a gown. Nobody will know. It is not obvious like this. But that's a procedure. You have to do an endoscopy and you have to do it. It's a little bit expensive. All the poor patients can't afford it.
Hmm.
And if it is for a short-term period, only during radiation we need, then you can just get away with the Riles tube. Why do you want to do this? So these
Obviously.
are the advantages. The third, so one is oral, one is enteral route, either a Riles tube or a feeding gastrostomy. The third route is a parenteral route where you give it through the IV line, like saline. You put it, you give saline, or you give something called TPN, total parenteral nutrition. So they are bags, big bags with some whitish colored liquid, like
Hmm.
looks like milk, which you give over a period of 12 to 18 hours. That goes into the blood.
Hmm.
That is not that preferred because it doesn't go into the stomach. There is no absorption. It directly you're giving some calories into the blood.
Yes.
That is given for extremely sick patients, somebody who is in the ICU, somebody who has intestinal issues, somebody whom you cannot put a feeding gastrostomy, somebody who's so sick that they have a few hours or days or just like that.
Hmm.
So more or less in head and neck cancer during radiation and chemotherapy, we put a Riles tube. We tell the patient, see, third, fourth week, you're going to have issues. You're going to have burning issues. You're going to have mucositis. You can't swallow. So if you're not able to even swallow your saliva, that's a problem. Then we'll put a Riles tube. I cannot treat you like this because you'll become so dehydrated. Your sodium will fall down. Your BP will fall down. You may even die. So to maintain nutrition, let us put a Riles tube. And through the Riles tube, every hour you'll be feeding. So you can give all your liquids through the
Hmm.
dal soup, bone soup. You can give coconut water, juices, kanji, all these things, rice water, okay, protein powders, milkshakes, whatever. In different consistency. Maybe mix it with little water here and there. Yeah. So usually you give 200 ml every 2 hours. You give
Okay.
every 2 hours you give 200 ml.
Hmm.
Sometimes if you're hungry, maybe you can go up a little bit more. Yeah. So that feeding is taught to the family member, and they can do it themselves. So at the this Riles tube has this end where we keep a syringe and in which we pour.
Oh.
So the patient gets good nutrition, and
Hmm.
if hunger is there, you probably escalate.
Hmm.
It can be done at home by the family and with
Oh.
home feeds, mind you, kitchen feeds. You're not buying something extra. So cost-wise, it is very useful for a family. Yeah. So the enteral feeding is the best. That is oral feeding versus the nasogastric way. This is how we navigate our patients during the tough time.
Yes, sir. In many of the advertisement also we have seen some pipe is coming out of it and some tapes are sticked. So I
That's
guess
called
that
a
is the
Riles
same.
tube. That's called a Riles tube.
Oh, okay, okay, okay. Doctor, very tough. And doctor, you were referring something related to cosmetology. I just clicked in my bed. Red teeth is better than that cosmetology.
No, true. So in the Western countries also, not that it is not there in India. So see, generally also, cosmesis and intimacy also. See, sometimes
Ye-
that also, see, any concern by a patient is a valid concern. Understand that. So if you
That's
ask a
true.
patient,
Yes.
he says with Riles tube and all, so I have intimacy issues, I have cosmesis issues, I can't go out, I can't see
Hmm.
people, I can't go to a shopping mall, people look at me. So I would prefer something which is more simpler, which is concealed, which people don't know. Why should the world know that I have a Riles tube? In India, we are more kind of see our first of all the financial part and all that, and then we see the easiest way to get things done from a patient point of view, and we don't want them to put to the hardship of all this. So in that bargain, cosmesis and all that takes a back seat.
Hmm.
We tell our patients, see, boss, 2 3 weeks job has to be done. Should be very simple, inexpensive for you because already you're
Very
spending a
true.
bomb on your treatment, and
Yes.
it should be effective. Your family should be able to do it at home with home feed. So when you say all this, then it's an office procedure, right?
So just out of the box, like when there is a nasal feeding happening, the how is what are the chances of getting infection? Is there any chances or it's
Yeah, there would be chances of infection with anything. This
okay?
gastrostomy also can get infected. But this is not nasal feeding, this is nasogastric feeding. It goes through the nose, but it actually goes into the tummy, into the stomach.
Okay.
So
Okay.
whatever feed
Okay.
you are giving is going into the stomach.
Directly to the stomach.
Unless you're pouring something outside, which it will fall through the outer part of the tube and it will
Hmm.
make it very clumsy and dirty. Yeah. And it can be, rice tube can be safely kept for 1 to 3 months also sometimes, depending on the case.
Oh,
Yeah, and you
okay.
have different sizes of riles tube. Sometimes a small size goes, sometimes a normal size goes.
Hmm. Oh, but better oral, this is the better option for a patients.
Oral is the best, the natural way, God given way. Next is nasogastric versus gastrostomy. Final is TPN.
Parental. Okay. So, doctor, like this was something on feeding. So, what precautions should be taken by a patient, like after post surgery or after radiation or during chemotherapy, like
So,
that?
as we said, gargle your mouth 5 to 6 times a day.
Yes.
Brush your mouth with soft brush with soft bristles twice a day.
Okay. Okay.
Hydrate yourself, lots of water,
Hmm.
liquids, juices, coconut water, etc. No spice, no outside food, home food, liquids, semi-solids, well crushed. Put it in a mixie, crush it well and give it.
Okay.
Yeah. And that's about it. That predominantly. And watch out for infections. If you're having WBC count, which is very low, ask your doctor whether you need a booster injection, GCS,
Hmm.
growth factor injections.
Hmm.
Yeah. So these are all the precautions we need to take. Surgery, keep your visiting your doctor periodically after surgery to see if the flap is okay. There is no wound infection.
Hmm.
When you're put on any kind of feeding tube, check with your doctor when it can be removed, when you can resume oral feeds. Forever you need not be on a Riles tube, right? 2 months after
Yes.
radiation, if you're perfectly, 1 month after radiation, if you're fine, you can start taking orally. Start with clear water, then we give you coconut water and some juices. And if you're taking well, you can as well remove the Riles tube.
Hmm. Very.
So the bottom line is anticipate the issues and move ahead.
So it is like, so then it is generally no, if the patient is okay, then he can come back to his normal life
Yeah.
after once he is
Yes,
recovered.
that is the whole point. We
Hmm.
don't want the patient to come every day and take a saline shot. We rather want him to be on nasogastric feeding and after 4 weeks of radiation, remove that and start resuming oral intake.
Oh, so doctor, right, like now you were saying something about the diet. So during this time or like during the treatment also, what is the ideal diet a patient should take?
An ideal diet is a balanced diet,
Okay.
high protein,
Hmm.
reasonable amount of carbohydrate, reasonable amount of fat, good vitamins and minerals. So in our diet, what would you have? If suppose I am a patient with head and neck cancer,
Hmm.
what would you say? I would say first, for a typical South Indian, when you get up in the morning, have a couple of idlis,
Oh.
take half a
Hmm.
glass or 1 glass of milk, avoid tea, coffee, take some coconut water sometime later.
Yes.
Whatever lunch you prepare, there'll be some sabji which is done.
Compulsory.
I ask my patients to take it in a small bowl or a katori and take. First have one. If you have carrot, if you have bhendi, you have dondakai in Telugu, just eat that little bit. So you'll have
Okay.
some vitamins and minerals, some beetroot. Then a couple of
Yes.
hours later, you can have some nice dal rice and then finish with curd rice and some buttermilk. We are not asking patients to take a full meal. Very little. Two idlis are not possible. Take one idli. 2 hours later, one glass of carrot juice or beetroot juice. 2 3 hours later, take some dal rice. Then an hour later, maybe some curd rice or just buttermilk or curd.
Oh,
Get up in the evening, have some semia upma or something. Or have some salad. No
okay.
coffee tea again. Or have some juice again. Evening, have a light dinner. See, this gives you multiple food items with different taste. And you are also not having a routine kind of a thing. Daily I'm having
Exactly.
idli only, daily I'm having dosa only means even I will be fed.
Yes, very true.
Okay, or you can have some cornflakes, whatever you feel like, or some bread. Okay, make it soft, make
Hmm.
it easily chewable, definitely not spicy. Home food,
Obviously.
home ingredients, well prepared at home, fresh food, not kept in the fridge after 3 days, not some
Oh,
spicy
okay.
biryani. Yeah. So these are all the things you have to take care.
So even, sir, doctor, what you are referring like bread and rotis, soak it in a milk and have it to make it soft.
See, uh, I don't know if you know this jonna roti we call Karnataka and
Ha
all.
ha.
There's a jonna
In
roti.
South it
Imagine a
is
patient without the dentition and a head and neck cancer patient. Can he have jonna roti?
no,
Can he
he
have
cannot,
very
doctor.
hard Malabar paratha?
No, doctor, he
It's
cannot.
difficult for them. They made or something made from maida. So have wheat chapatis. For us, that is preferable. As you said, soak it in dal or soak it in curd
Hmm.
and have it like how you take a paratha.
Hmm.
Paratha, at least maybe you may find it a bit spicy. This one is easy.
Yes. Yes.
Okay. So these are we have to find a way in our normal diet plan. Also, this should not affect the other family members. What will
Mm.
happen is, if for my sake, my family has to prepare, it cannot be a continuous process, no?
Yes, yes, very
So
true.
in the whole situation, chalo we are preparing idlis, okay, Krishnamani will take one idli. We are preparing some beetroot, chalo isko beetroot juice bana ke dete hain. Dal chawal is being made, you have something. Maybe you can, for me, that spice factor can be reduced a little separately. But out of the box, you need not, for me, you have to prepare something for somebody, then it is not a long-term process. Then the patient gets defeated. For 1 week, they will can prepare. Not that they don't want to do, but they can't.
Very
Because
true.
this guy is dependent on other people also. And
Mhm.
they have their lives and they have to support him also. So you have to find a way which aligns with the family, where every person in the family is a stakeholder.
And very true, doctor. Generally, what happens no every day preparing a different meal, family also will lose little bit of somewhere they will be demotivated. Every day they
Not,
cannot.
it's not practical.
Yes, it's not bad. Because already the patient has gone through a treatment that has taken many of the precautions for a family to adjust. After that, also, it will be little bit for them also a
Right.
challenging kind of a thing. So, like doctor, now you are talking to something vegetarian. What will be the role of supplements, like any supplements, protein supplements like that? What will
People
be the
talk
role of
about,
those?
so there is a lot of talk on protein supplements and all that. But if you
Yes.
ask me personally, I would say nothing beats home food. Unless you are nutritionally and calorie deprived,
Hmm.
you would need some additional protein supplements and all that. Mind you, they also have their own issues like constipation, a, a feeling of stickiness in the mouth, and the
Hmm.
routineness and all that. Okay, so nothing to beat your home food. People have looked at that is called, I don't remember the exact name, nutrition addition versus uh, yeah, in people have looked at additional nutrition or supplements in cancer cachexia syndrome, we call
Huh.
cancer
Huh. Huh. Huh.
cachexia anorexia syndrome, CAS we
Yes.
call.
Yes.
So if you look at that, the emphasis is on nutrition per se, which is from the family, from the house. It's the supplement, the word itself is it's only a supplement. It cannot be a replacement. So I am not a very big fan of supplements. The data is very conflicting. In the
Hmm.
hospital, you'll have dietitians, you'll have those people, these people recommending this and that and all that. Your home food, your protein, your dal, your egg, your chana, soya, nothing to beat it.
Actually, nowadays, doctor, the supplement has become a very trendy, you can say. Everybody, even okay, for they will have a different set, like for diabetic, one set of protein powders or a supplements, cancer patient supplements. This is a dedicated supplements for cancer
So
patient.
let us understand. Don't so we all have butter in our hand, but we are running for ghee. Okay. So your butter in your hand
Very
is
true,
your home
doctor.
food. Your home food is
Yes,
already there. People are preparing excellent food for you.
yes.
Now, just coming a little bit out of that. Imagine, see, what is a typical South Indian diet? We keep talking. When you sit for lunch, what do you have? You take rice, which is
Yes,
carbohydrate. You add dal, which is protein. You
protein.
add a little
Yes.
bit of ghee, which is fat. And you have
Mm,
curries, which are full of vitamins, minerals, water.
yes. Very true.
Imagine
Yes.
something like a drumstick, something like a radish
Mm,
sambar, a tomato rasam. And then
yes,
finally
yes.
you have curd, which is ready to coat your stomach and intestines with lactobacillus so that everything is well digested.
Yes.
Okay. And the I read this somewhere, the typical Indian way of eating. We sit on the couch nowadays and eat on the table and all that. Typical Indian way is you sit down in a plantain leaf. The plantain leaf has got so much of nutrition. And by the time you
Mm,
finish, everything is mixed in your food. And the
yes.
constant movement of going like this and eating, going like this, picking up and eating. There is a movement even during food intake. That is an exercise which we do not know. So there is a reason why your fathers, forefathers, elders told you to sit down and eat.
Yes.
Eat from the table. What is there? Half the
Nothing.
time you're looking at your mobile and eating. You don't even know what you're eating. Even for cockroaches.
Exactly. Very true. And
So
nowadays, this is also not there. Only this, a spoon
this is
movement.
so. See, when you eat, we should relish it.
Yes.
Yeah, so I'm going away from the topic. I know joy of licking your fingers and eating, and the joy of mixing the food, the joy of so basically it should be a balanced diet. That's the bottom line. And in the Indian diet is a very, very balanced diet. Idli is a steamed food.
Hmm.
Go anywhere on the planet, you take idli, your stomach will not go wrong.
Very true,
You
sir.
may have a problem. Masala dosa, you may have a problem because the masala may be old. But fresh
Yes.
idli will never give you trouble.
Anywhere, even on the road, also we can eat
So
idli. It will
that
be
is the
fresh.
beauty with our food. So that emphasis should be told to our patients. See, boss, have good home food, nutritious food. Maybe definitely less, no spice or less spice. Maybe little less oil, but take everything. I can't eat sugar. Nothing white should be taken. Rice is dangerous. There is nothing like that. Are you eating kilos of rice every day? You are hardly taking a morsel of rice. And
Yes.
that carbohydrate you need for your body to function.
Very true. Sir, no white concept is generally has become a very big funda, but it's, I don't know, I cannot avoid white.
2 years later, you'll go back retro. Anything retro is always good. So they'll say everything white is good.
Very true. Wow, that's such a food and supplements play such an important role for a patient and everybody in their lifestyle, doctor.
Yeah, yeah. So they see, we talk about food, stop. We talk about no rice in the night. We talk about not even this much ghee also should not be put in the food. But we are ready to go to McD and eat nice French fries. Or we're really happy to have a full gallon of beer and smoke and eat oily chicken. That will not trouble
KFC,
your
fried chicken.
that will not be troublesome to your tummy, but a bit of dal rice with a tinge of homemade ghee is cancers.
Very true, doctor. Generally, they should adopt, there is a called a cheat day. That cheat day should be adding of ghee and oil instead of adding the burgers and pizzas into their
Perfect.
diet.
No, have burger, pizza. Nobody's saying no, even I have. I'm not trying to be saint here and all that. But I'm a big advocate of home food and food which is prepared in your family. See, that is more important. Food which you people are accustomed to. Now, you suddenly ask me to eat 4 times a day chapati. I'm not. I'm a South Indian. I'm used to eating rice. Chapati maybe once in the night, every day, or maybe once in 2 days. You can't ask a Punjabi to come and say, who has eaten forever parathas, only eat rasam rice, sambar rice, vetapalam rice. He cannot. He cannot adjust.
Very difficult,
So
yes.
your native, what is your this one? But maintain a balance between your calorie intake and your expenditure of calorie in the form of walking or gymming or running or whatever you want to do. That's the final part for somebody who would want to maintain a healthy lifestyle.
So, in short, the general punchline is like eat homemade food with less spice
Yes,
or
especially
hashtag
for
no spice.
academic cancer patients, uh, play a lot of emphasis on your nutrition.
Hmm.
Nothing to beat things like what we discussed. Try to make things in a very soft consistency that will really take you forward. And the fourth, fifth week or third to fifth week of radiation is the crucial part. If you are navigating it by oral intake with some minimal discomfort, without losing a lot of weight, the battle is won.
Then you can say the patient is in a successful track of getting, he is like treatment
Right.
journey.
Yeah.
Thank you, doctor. Thank you very much for your valuable time because this information I can assure that 100% will be useful for those patients because as we have startingly discussed that patient will be interested in what type of cancer, how much of treatment, everything, but they will never like focus on what should be eaten and what nutrition should be maintained in the body. So, frankly speaking, through this session, as I told, the learning will be like eat homemade food, best nutrition or like required nutrition with less spice or no spice. Avoid outside food, doctor.
Easily
So,
digestible food. Yeah.
doctor, would you like to give some closing impactful statements so which will be a learning for everybody?
So finally, I would just say that see, nutrition plays a big role in head and neck cancer patients. If you are going to be nutritionally deprived, your outcomes are going to be bad. Your treatment cannot continue the same pace at the same time. So play emphasis on it. And as all we discussed, you have a logbook or you write down in a diary that every 2, 3 hours, this is what you have to do. Maintain the nutrition. Don't be too emphasized about this much calories, that much calories. If you are healthy, you have good stamina, you are taking food on time, and you're not losing weight, you're doing well.
Thank you, doctor. Thank you very much for such a beautiful information on nutrition in head and neck cancer. Thank you, everybody, and wishing you all good strength, good health, and obviously, please spread awareness on head and neck cancer. So,
Thank you.
thank you very much. Bye, doctor. Bye, everybody.